Lung cancer. Everybody knows that cancer is not good news, and anybody who has had cancer or is living with it understands how awful the disease is. In 2021, almost 1.9 million Americans were diagnosed with some kind of cancer, and by January 2022, the American Cancer Society reported more than 600,000 people with a history of lung cancer. Keeping aside the costs of healthcare and the overall US economy aside, the disease is taking a serious toll on the quality of life of the people affected. And the more we know about it, the more we can advocate for its prevention. Lungs are present in our chest cavity, are pinkish, and differ slightly in size to make space for the heart. They help the body breathe and get oxygen, and thus are an important part of the respiratory system. Any bad thing happening to them could disrupt normal breathing. And as we said before, cancer is just bad news. Just like any other cancer cell, a cancer cell in the lung also divides uncontrollably and makes a mass of tissue from abnormal cells called a tumor. These cancerous cells do not undergo a normal cell cycle where they are supposed to die and the body gets rid of them. Instead, they keep on dividing and making tumors, which can spread to other body tissues and cause pain, destruction, and complicated diseases. The sad truth is that lung cancer doesn't just restrict its chaotic destruction to the lung tissue, but also affects different parts of the body. The cancerous cells can also spread to other body parts, such as bone cells. In this video, we'll help you understand more about what lung cancer is and how to look out for its classic signs. Let's talk about the signs and symptoms of lung cancer first. Lung cancer can be indicated by the body in several ways, but there are some common signs to look out for. Number 6. A bad headache. Small cell lung cancer, or CSLC, can cause hypercalcemia, which means that the bone releases a greater amount of calcium in the blood and subsequently, the calcium levels in the blood rise. This can cause headaches in lung cancer patients. The type of headache could be mild or intense, but people need to look out for them. Number 5. Feeling tired all the time. When cancer cells keep dividing in the lungs, they make it difficult for healthy lung cells to function properly. As a result, the lungs aren't able to breathe in and breathe out, and that can cause a strain on the body, leading to the person feeling fatigued. If people find trouble breathing, they won't be able to do simple tasks such as walking up a flight of stairs, and even going on a walk with friends may seem like a very tiresome activity. Number 4. Frequent chest infections. Lungs with cancerous cells have a compromised immune system, and this means every kind of chest infection has the opportunity to attack lung cells. Bacterial infections, such as pneumonia, can occur, but fungal and viral infections aren't an exception. All foreign, disease-causing agents target these vulnerable lungs, and what happens is that a lung cancer patient suffers from different kinds of chest infections that start to happen more frequently. This is a scary fact, because infections are considered to be the second most common threat to life, after tumors, for people with lung cancer. Number 3. Not feeling hungry. Lung cancer patients experience pain, digestive issues, and this can contribute to them losing their appetite. Because of treatments like chemotherapy and various medications, patients can experience mouth sores and a bitter taste, and they may not want to eat at all. This is dangerous because the body will be deprived of its required amounts of nutrients. Number 2. Losing weight. You must have been expecting this to come next, because when people lose their appetite, they don't eat enough. And when their bodies don't receive sufficient nutrients and minerals to stay healthy, they start to lose weight. An involuntary form of weight loss is a condition known as cachexia and is found in 80% of people who are in the last stages of lung cancer. Cancerous cells use up a lot of energy from the body, and less energy is then available for healthy cells, and this means the body uses up more calories than it would normally do. This can alter the body's weight and result in loss of weight that people cannot explain but can be justified by the presence of cancer cells in the lungs. Number 1. A bad cough. The most well-known sign of lung cancer is a bad cough, sometimes accompanied by blood. The presence of a tumor can trigger a response from the body, causing it to cough. It might also cause a condition called pleural effusion, in which there is unnecessary fluid around the lungs, which can cause people to cough. Even though many chest infections cause people to cough, it is also the number 1 sign of lung cancer and should be diagnosed. These were all symptoms of lung cancer manifested by the human body to alert it about the possibility of cancerous cells in the lungs. But how does it ever happen? We know that cancer cells are just cells that keep on dividing, are out of control, and invade other healthy cells. However, many other factors can contribute to the change in the DNA of healthy cells, making them cancerous. We're going to discuss a few of them next. Number 4. Having HIV. Human immunodeficiency virus, or HIV, can significantly weaken the immune system of a person, so the body has a hard time fighting off diseases. Research has found lung cancer to be associated with HIV-related complications, such as immunodeficiency and also inflammatory processes. Although it isn't a primary risk factor for lung cancer, however, both these diseases are connected. Number 3. Exposure to asbestos. Asbestos is usually used in the manufacturing of building materials, but is very dangerous to health and classified as a cancer-causing material. Many researchers have linked exposure to asbestos with lung cancer, and people who have a job that makes them come in contact with asbestos are encouraged to quit smoking. Number 2. Genetics. Many types of cancers are because there is a cancerous gene that runs in the family. This is true for lung cancer patients as well, because it can increase the risk of developing lung cancer. However, the rough estimate for lung cancers that runs in families is only around 8%, so the risk is low. Number 1. Cigarette smoking. Perhaps the most dangerous and well-known cause of lung cancer is the one that we've all heard about, but don't take seriously. Not only does cigarette smoking cause a multitude of health problems, but it is the leading cause of lung cancer, responsible for shortening the lifespan of smokers. People who smoke cigarettes are 15 to 30 times more likely to develop lung cancer than non-smokers, and they also put others at risk, because passive smoking can also cause lung cancer in people who never smoke themselves. This is why it is the leading cause of lung cancer-related deaths. The American Cancer Society reports that more than 84% of women and more than 90% of men who were diagnosed with lung cancer either smoked or used to smoke. Hold up, what about the cure? Is lung cancer curable? Well, that depends upon the stage of the cancer's progression, and cure rates drop as the cancer reaches more advanced stages. However, doctors may recommend a few procedures to mitigate the progression of cancer depending upon its stage. For example, they might perform a surgery where they try to remove the cancerous tissue from the lungs. They may also suggest chemotherapy, where special medicines are injected inside the body to help slow down the cancer. There are also different kinds of medicines that a cancer patient takes to complement other forms of treatment. The right treatment can only be advised by a pulmonologist or a medical oncologist after they have made a detailed diagnosis of the patient's condition. Living with cancer or with someone having cancer is not easy because of how physically as well as emotionally demanding it is. However, medicines and doctors aren't the only options. First and foremost, people should immediately quit smoking. Not only does smoking increase the risk of lung cancer, but it also interferes with the treatments that are designed to overcome it. For example, the toxic substances found in cigarette smoking may alter the cells, and the drugs designed to target these cells may not be able to detect them, which may make them inefficient and the tumor may persist. You can also start to do some exercises because it will help keep your mood happy and you would be more active. Another important thing to do for yourself is to eat good food, even when you don't feel like it. Medicines and treatments can leave you in a better mood, but choose your food wisely and commit to your health. That was all from our side, folks, and we hope that you now know more about lung cancer. If you or a loved one is going through lung cancer, remember to stay empathetic. Be kind to them or yourself, because it might not be an easy battle, but it is conquerable. If you liked finding out about lung cancer and you believe that you know more now, make sure to like this video and share it with someone who may benefit from it as well. Remember to subscribe to our channel as well so that we can keep bringing more health-related information to you. Until next time.